Hello everyone, let's talk about free birth. Not to scare you, not to shame you, and definitely not to take away your autonomy, but to say the quiet parts out loud, the things doctors often think, but don't always say publicly, because informed choice only exists when all the information is on the table. Let's start with something that doesn't get said often enough, especially by doctors in public spaces. Many of us understand why some people choose free birth. Truly, this isn't confusion, and it's not ignorance. It's usually a response to feeling unheard, dismissed, rushed, or even harmed by the medical system. And that matters. For some people, pregnancy care has felt cold instead of caring. They've been talked over, not talked with. They've had their pain minimized, their preferences ignored, or their bodies treated like problems to manage instead of people to respect. When you add past trauma, systemic bias, or fear of unnecessary interventions, it makes complete sense that someone would say, I don't want to do this again. Doctors don't always say this publicly because it requires us to admit that medicine doesn't have a perfect track record. And the truth is, it doesn't. Obstetrics, in particular, has a history that includes paternalism, racism, and a tendency to prioritize protocols over people. Acknowledging that isn't weakness, it's honesty. So when someone chooses free birth, it's often not about rejecting science, it's about reclaiming control, it's about wanting privacy, dignity, and trust. And those are valid desires. No one should be shamed for wanting autonomy over their body and their birth experience. But here's where the quiet distinction comes in. And this is the part doctors think about even when they don't always say it out loud. Understanding the motivation behind free birth does not automatically make it medically safe. Compassion for the why doesn't change the risk. Doctors can hold empathy and concern at the same time. Those things are not opposites. In fact, they belong together. When a doctor raises concerns about free birth, it's not because they believe people are incapable of making decisions. It's because they've seen how fast birth can change. They've seen low-risk pregnancies turn high-risk in minutes. They've watched outcomes hinge on equipment, medications, and trained teams being immediately available. And saying that out loud can feel uncomfortable because no one wants to sound dismissive of someone's lived experience. Doctors worry that speaking plainly will be interpreted as judgment or control when what they're actually feeling is responsibility. There's also something else doctors don't say often. We wish the system made fewer people feel pushed toward free birth in the first place. We wish respectful, trauma-informed, patient-centered care were the norm everywhere, not the exception. Because no one should feel like avoiding medical care is the only way to protect themselves. So yes, doctors understand why people choose free birth, we really do, but understanding doesn't erase biology, unpredictability, or risk. And saying that honestly isn't an attack on autonomy, it's part of respecting it. Because real choice only exists when empathy and evidence are allowed to stand side by side. One of the hardest things for doctors to talk about openly is how deceptive low risk can be. Pregnancy and birth can look perfect on paper. Normal labs, normal ultrasounds, no warning signs, everything checking the right boxes. And most of the time, that really does end with a healthy parent and a healthy baby, but not always. Birth is not a slow, predictable process where problems politely announce themselves ahead of time. Some of the most serious complications in obstetrics happen suddenly, without any prior red flags. And that reality is deeply uncomfortable, because humans want reassurance. We want to believe that careful planning or intuition will give us enough warning to act. Medically, that just isn't reliable. Doctors don't always say this publicly because it sounds frightening, and fear has been misused in birth conversations for decades, but silence doesn't make unpredictability go away. A shoulder dystocia can happen in a matter of seconds, even with a baby who isn't considered large. A cord can slip out after a rupture of membranes with no warning. A uterus can hemorrhage rapidly after a completely normal labor. A baby can tolerate labor beautifully, until suddenly they don't. None of these events require negligence, bad choices, or doing something wrong. They are biological events that sometimes just happen. This is where experience shapes perspective. Doctors and midwives who work in high acuity settings don't talk about rare complications as abstract statistics. They remember faces. They remember moments where everything was fine until it wasn't. And those moments are why predictability is not something medicine pretends to have. Another thing that isn't said enough is that outcomes don't always depend on whether a complication occurs, but on how quickly it's recognized and managed. Seconds matter, minutes matter, and that's not about fear, it's about physiology. Oxygen deprivation, blood loss, and infection progress on biological timelines that don't pause for decision making. This doesn't mean people who choose free birth are reckless or unaware. Many are deeply informed and intentional, but knowledge alone cannot control biology. You can do everything right and still encounter something no amount of preparation can fully manage without trained support and immediate resources. Doctors are often careful with this topic because they don't want to imply that every birth is a crisis waiting to happen. That isn't true. Most births are uncomplicated, but some complications don't give you the courtesy of gradual escalation. They arrive fully formed. And that's the part that sits heavy for clinicians, not the normal births, the ones that change direction in moments, the ones where the difference between tragedy and recovery came down to time, tools, and a team already in the room. This isn't about undermining trust in your body. It's about acknowledging reality. Pregnancy can look perfect, feel perfect, and still surprise us. Pretending otherwise doesn't empower people. It leaves them unprepared for how fast birth can change. One of the most uncomfortable truths for doctors to say out loud is that emergency care is not just about knowing what to do. It's about how fast you can do it. Skill matters, knowledge matters, calm decision-making matters. But in obstetrics, time is often the deciding factor, and time behaves very differently outside a medical setting. In hospitals and birth centers, emergencies are planned for before they ever happen. Blood is already typed and available. Oxygen is already flowing through the walls. Medications are stocked and within arm's reach. Operating rooms are prepped. Teams train together over and over again so that when something goes wrong, there isn't a discussion. There's a response. At home, even with preparation and good intentions, those systems don't exist in the same way. Transport has to be arranged. Help has to be called. Roads have to be driven. And while all of that is happening, the body doesn't pause. Bleeding doesn't slow down because an ambulance is on the way. A baby who needs oxygen doesn't get extra time because the plan was thoughtful. Doctors rarely say this publicly because it sounds harsh, and no one wants to imply that a home environment is careless or that parents are unprepared. But emergency medicine is not about blame, it's about logistics. A postpartum hemorrhage can become life-threatening in minutes. A newborn who isn't breathing effectively needs intervention immediately, not eventually. When doctors talk about risk, this is often what they mean. Not the likelihood of something happening, but the consequences if it does and how quickly those consequences unfold. Another quiet reality is that many emergency interventions require more than one set of hands. Managing a crisis often means someone monitoring vital signs, someone administering medication, someone providing neonatal care, and someone coordinating next steps all at the same time. That level of simultaneous care isn't about trust or philosophy. It's about capacity. This doesn't mean that every hospital intervention is necessary or that every home birth will end in an emergency. Most won't. But when an emergency happens, the setting changes what is possible. Doctors struggle with how to talk about this because they don't want fear to be the driver of decision-making. Fear has a long history of being weaponized in birth care, but avoiding the conversation entirely doesn't make it more respectful. It just leaves a gap where realistic planning should be. The truth is that emergency care isn't interchangeable. A plan to transfer is not the same as immediate access. A well-researched response is not the same as an already assembled team. These differences aren't moral judgments, they're structural ones. When doctors emphasize this point, it's not because they assume something will go wrong. It's because they've seen what happens when seconds stretch into minutes. They've seen how outcomes can hinge on how close help already was. This isn't about fear, it's about acknowledging that in birth, speed can be life-saving. And speed is something home settings simply can't guarantee in the same way. One of the most persistent myths around birth is the idea that if something is natural, it must automatically be safe. Birth is natural, yes. It's also one of the most physically demanding events the human body can go through. And nature, while powerful, has never promised safety. Doctors don't always say this out loud because the word natural has become deeply emotional. For many people, it represents trust in the body, rejection of unnecessary intervention, and a desire for a more human experience. Those values matter. But medically, natural isn't a risk assessment, it's a description. Blood loss is natural, infection is natural, blood clots are natural, so are seizures, organ failure, and stillbirth. Throughout most of human history, birth was natural, and maternal and infant mortality were devastatingly high. Modern medicine didn't replace birth. It stepped in when nature failed to protect people. This doesn't mean the body is broken or incapable. Most births proceed without major complications. But when something goes wrong, it's not because someone interfered with nature. It's because biology doesn't always follow a gentle script. Doctors often hesitate to push back on the natural equals safe narrative because they don't want to undermine confidence in the body. Confidence is important. Fear and stress can negatively affect labor. But confidence built on incomplete information is fragile. When reality doesn't match expectation, it can shatter trust instead of strengthening it. Another part of this conversation that rarely gets attention is survivorship bias. We hear the stories of births that went beautifully without medical involvement because those stories can be told. We don't hear from the families whose outcomes were tragic because grief is quieter and often private. That silence can create the illusion that rare outcomes don't exist when in fact they do. When doctors talk about risk, they're not saying nature is the enemy. They're saying that nature is indifferent. It doesn't know your plans, your beliefs, or your intentions. A uterus doesn't care how much research you've done. A placenta doesn't behave better because the environment feels calm. Biology follows its own rules. This is also why interventions aren't the opposite of natural. They're responses to it. Medications that stop hemorrhage work with the body's physiology. Surgery corrects anatomy when it fails. Oxygen supports tissues that are struggling. These aren't betrayals of birth. They're tools designed to keep people alive when nature pushes too far. Doctors don't say this loudly because birth culture has turned the conversation into a binary. Natural versus medical. Trust versus fear. Empowerment versus control. Real life isn't that simple. You can trust your body and still need help. You can aim for a low-intervention birth and still benefit from backup. Acknowledging that natural doesn't mean risk-free isn't pessimism, it's realism. And realism doesn't take power away. It gives people the ability to prepare for birth as it actually is, not just as we hope it will be. Autonomy gets talked about a lot in birth conversations, and rightly so. People deserve control over their bodies, their medical decisions, and their birth experiences. But there's a quieter part of that conversation that doctors often struggle to say out loud. Autonomy without accurate, complete information isn't real choice. It just feels like it is. Doctors don't always speak plainly about risk because they're afraid of being labeled coercive or dismissive. There's a long history of patients being pressured, ignored, or overridden in obstetric care, and that history matters. But swinging to the opposite extreme, where clinicians stay silent to avoid conflict, doesn't protect autonomy. It undermines it. Informed consent isn't just about signing a form or agreeing to a plan. It's about understanding what could happen, how likely it is, and what the consequences might be if it does. That includes worst-case scenarios, not because they're expected, but because they're possible. Leaving those details out doesn't make a choice more empowering, it makes it incomplete. This becomes especially important in conversations about free birth, where information often comes from social media, personal stories, or communities built around shared values. Those spaces can be supportive and validating, but they're not neutral. Like any community, they tend to amplify positive outcomes and minimize or explain away negative ones. That's human nature, not malice, but it shapes perception. Doctors worry about being seen as fear-mongering when they talk about rare but serious risks. Yet those risks don't disappear because they're uncomfortable to discuss. Avoiding them doesn't make birth safer. It just shifts the burden of discovery to the moment when something has already gone wrong. Another part that isn't always said is that declining medical care doesn't mean declining medical consequences. If a complication arises, the body responds the same way regardless of philosophy. Bleeding doesn't slow down because a choice was intentional. A baby doesn't recover faster because the plan was deeply considered. Biology doesn't negotiate. Respecting autonomy means respecting people enough to tell them the truth, even when that truth complicates the narrative. It means trusting that someone can hold both empowerment and risk in their hands at the same time. Doctors don't always do this well, and that deserves criticism. But silence isn't the solution. There's also an emotional cost to incomplete information. When outcomes don't match expectations, people often blame themselves. They're told they didn't trust their body enough, or they missed a sign, or they made the wrong choice. Full information doesn't prevent grief, but it can prevent unnecessary guilt. Autonomy isn't about being left alone with a decision. It's about being supported with honest, evidence-based information and then trusted to choose. When doctors speak up about risks, it's not about taking control. It's about refusing to abandon people in the name of politeness. Real choice requires honesty. And honesty, even when it's uncomfortable, is one of the deepest forms of respect. There's a belief that when doctors speak out against free birth, it comes from a place of judgment or a desire for control. That belief is understandable, especially given the history of obstetrics. But what rarely gets said is that many of those conversations are rooted not in authority, but in grief. Doctors carry memories that don't make it into statistics or public discussions. They remember the newborn who was brought in too late, the hemorrhage that escalated faster than anyone expected, the parent who did everything thoughtfully and intentionally and still lost something they can never get back. These experiences shape concern in ways that are hard to explain without sounding dramatic or paternalistic. When a doctor expresses worry, it's often because they've already seen the outcome they're trying to prevent, not in theory, in real life, with real people. And those experiences don't disappear just because the topic is politically or socially sensitive. Doctors don't say this often because they're taught to be neutral, professional, and restrained. Showing emotion can be interpreted as bias. But caring is not a conflict of interest. It's the reason many people go into medicine in the first place. Disagreement doesn't mean disrespect. A doctor can fully support someone's right to choose and still feel uneasy about the risks involved. Those positions are not mutually exclusive. The tension comes when concern is mistaken for condemnation. Another quiet truth is that doctors often wish they had met someone earlier, before the emergency, before the loss, before the irreversible moment. They wish the system had been safer, more compassionate, more worthy of trust, so fewer people felt pushed to choose between dignity and medical support. This isn't about saying, "I told you so." It never is. In moments of crisis, there is no satisfaction in being right. There is only the weight of wishing the outcome had been different. Doctors don't always say publicly that when things go wrong in birth, they don't blame the parents. They blame biology. They blame systems that failed to provide respectful care. They blame gaps in communication. But self-blame often falls on the people who gave birth, especially when they were told they should have trusted themselves more. When doctors speak with urgency, it's not because they think people are incapable of making decisions. It's because they know how final some outcomes are. There are no do-overs in birth. There are no rewind buttons. At the core of these conversations is a simple goal that often gets lost in ideology: alive parents and alive babies. Not perfect births, not ideal stories, lives. Doctors care deeply about that outcome, even when their voices come across as blunt or cautious. Their concern is not about winning an argument. It's about preventing loss. That care doesn't disappear when someone chooses differently. It stays, quietly, heavily, and often unspoken. But it's there. You deserve respect. You deserve autonomy. And you deserve accurate, evidence-based information, even when it's hard to hear. Because the goal has never been control. The goal has always been alive parents and alive babies. That's the part doctors don't always say publicly, but it's the part that matters most. Thank you.